Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone, myself Dr. Sumit Khupse. I'm a consultant neurologist and I have special interest in epilepsy. I'm working as a consultant neurologist at Khupse Hospital, Durga Chowk, Akola.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Actually, our brain uses tiny electrical signals to coordinate with what we think, how we feel, and what are the exactly things happening with us. If the electrical burden of this electrical stimulus is excessive and abnormal, then it results into the seizures. Usually, patients may have some jerking movements or shaky movements. A patient can lose its consciousness. There will be abnormal feeling. There will be staring look. So this is actually what epilepsy is, and some of the doctors describe it as a storm in brain. So that this excessive and abnormal electrical stimulus results into all these things that presents as a seizure.
What is epilepsy?
Actually, epilepsy is a medical condition where their patient has had repeated episodes of seizures. So medically, epilepsy is diagnosed when patient has two episodes of unprovoked seizures. Unprovoked means there should not be any other conditions such as infections or any kind of any illness that resulting into such kind of seizures. So if any patient has a two unprovoked seizures, it is labeled as epilepsy. There can be different types of the epilepsies. Some can have one type, and other people can have more than one type of epilepsies.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures. So it depends upon the where it starts in the brain and how much and what part of the brain is involved in that. So there are two types, basically a generalized and a focal, or it's also called a partial. So generalized means the whole of the area of the brain is involved, and focal or partial means only some part of the brain is involved. So depending on that, there are two types: generalized and focal or partial.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, not always we have a cause. In fact, 50% of adults that presents with epilepsies don't have any definite cause for their epilepsy. So usual causes are some of the head traumas, brain infections, and tumors. And if we consider the people who are more than 65 years of age, there can be a causes such as Alzheimer's disease or stroke. But suppose if the patients who are there and those don't have any significant underlying cause, so sometimes genetic cause can be there. Genetics is linked with the repeated episodes of epilepsy. In some of the patients, genetic conditions can also be one of the cause.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, some of the signs that one should look after is sometimes these patients can have jerky or shaky movements. There will be loss of consciousness. There will be brief episodes of staring with loss of consciousness. There will be falls, and sometimes there will be feeling of fearfulness or panic conditions. So some of unusual feelings also sometimes patients can get. So there are different types of types and different symptoms. But if you have any of these, you should always consult a doctor for regarding your further treatment.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, unfortunately, historically there has been many things that has associated with the epilepsy, and it has been proven that it's a neurological condition. And there is a lot of stigma. People who are having with epilepsies are not granted the access to the society, and people sometimes these epilepsies can be sometimes frightful, so people try to react with avoidance, or that's why there is a stigma associated with it.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yes, apart from medications, that patient might miss the medications, and that can be a very common trigger. But apart from that, there are very common triggers such as the missed or skipping the meals. There will be inappropriate sleep. There can be some of the infections or fever that is patient is having. There is the excessive use of screens or flashes of lights. So these are the common triggers that patient should take care of.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Actually, these patients can have also have falls, so we should appropriately manage that wherever they are roaming or in house, there should not be any cords or clutter. It should be cleared. People should always take care of that edges of the tables, or some sharp objects should not be there around them, so that they can avoid. And if required, there can be we can put soft carpeting for the floor also.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, actually, they should be kept on the left side. All the tight clothes around their neck or should be removed. They should breathe normally. We should not put anything into their mouth. And as I told earlier, the surrounding or environment should be free from clutter, cords, so that they should not have fall. And if there are the chances that patients are having repeated falls, then we should take care that there should be a proofing, fall proofing of the house should be done.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, I think epilepsy is curable. Patients who takes very good care of their conditions, who get treated, leads to a very good life and able to manage their condition. So there have been many famous personalities who had this problem, but they have led a very good life in their professional as well as personal life. So taking care of triggers, having a healthy habits such as taking care of your sleep, meals, avoidance of excessive screen time, and having a support group, so that you are not alone in this fight. There are support groups, and we are always there for you.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.